Well, I've gotten the go that we've reached our limit for our number for participants who RSVP'd. So thank you guys for attending. We'll go ahead and get started. So again, I want to thank you all for joining, and I'm going to provide just a few administrative updates before we get started today. First of all, please feel free to submit any additional questions for the panelists via the webinar question and answer box. Today's run-up show will consist of an introduction of the panelists by Dr. Nguyen, followed by a brief panel discussion. We are seeking feedback from all of the attendees on how you engage with your communities. We will include a brief pre-webinar poll to get insights into this, and we'll follow up after question and answer to see how this may have shifted based on today's discussions. Post-webinar, the recording will be available online, and we welcome any feedback from our post-event survey, which will go out later this week. Again, thank you for attending, and I will turn it over to Dr. Nguyen.
Again, Dr. Wright, thank you again for your continued efforts with this program. I really love the framework of this program of optimizing community partnerships. And I think before we begin, I just have to, thank all the webinar attendees. I certainly have to thank all the grantees. You guys have been wonderful. And I think as a collective, we really have, I think, and are starting to really make a difference. I want to thank all of our partners and especially our community panelists. I really thank you for taking time, certainly out of your day, to sort of share your wisdom with us. I want to remind everybody that the Alliance has three main goals. And the first was building sustainable community partnerships to address barriers to cancer care related to the social drivers of health. And remember, the second goal was to emphasize the importance of community partners in our care continuum, including working with diverse groups. For example, non-health, directly health-related care organizations, et cetera. The third one was to recognize, and this is where I'm going to tip my hat and just sort of say thank you to Merck. Thank you to the leadership. Thank you to everyone from that group who really chose to have the vision to be able to help support this alliance. And we're going to continue to encourage collaboration and commitment even as we continue on, look past year 3. It's in that spirit that I would really like to introduce our 3 panelists. And I don't want to take too much time from them because they're just amazing people. Because if I start reading, it's going to take me half the day. And then you know what? Then y'all be mad with me about, well, listen, why didn't you just let them talk? Because that's who we came here to hear from. So I'm going to keep it short. I'm first going to introduce Nancy Elliman, Director of the Community Outreach for the Hoboken Family Planning. You're also the chair of the Alliance Community Advisory Council. And it'll come out in what you do. You just are doing so many things, but really key, you're making impact within the state and within your catchment area, which I really love. Thank you, Nancy. I'm then going to introduce Brittany Church, patient advocate and breast cancer thriver. She's also a member of the Alliance Community Advisory Board for Case Comprehensive Cancer Center. And as we all know in the Midwest, we're locking up the East, but the reality is in the Midwest, there's lots of diversity as well. And Case, I want to thank you, the folks at Case, for, again, trying to make a difference through this program. And last but not least, Jairo Guzman, who is the founder and president of the Mexican Coalition for the Empowerment of Youth and Families, Inc. And this community partnership is in the context of that with Memorial Sloan Kettering in New York and the ICANN Equity Platform. I want to say thank you for all that you have done. Thank you for providing us with a foundation of this rich discussion. And I'm going to turn this over to Dr. Wright. And but they told me to try to be quiet, but I'll try not to jump in, but I swear to God. But I'm so excited about having the three of you that I may actually just jump out of my seat every once in a while and answer a quick question that's not on the page, but we're gonna see if I can be behaved. Anyways, I'm gonna turn this back over to Dr. Wright. Dr. Wright, the floor is yours.
Um, we'll see how long he stays quiet, right? So let's give it a try. We're gonna kick it off with Nancy. And where each panelist is gonna give like a brief overview of what we're calling their expertise topic today, their expert topic today. And so Nancy will start and we'll follow by Brittany. Nancy?
Okay. Thank you very much, Dr. Wright. So my name is Nancy Aleman, and people are always very surprised that I speak Spanish fluently. I lived in South America, specifically in Venezuela, for over 30 years. Like Brittany, I am also a breast cancer survivor. I was diagnosed with stage 3B breast cancer while I lived in Venezuela, and I had my own company at the time. And Heido, I was a assiduous patient and client of Memorial Sloan Kettering while I was going through my treatment. I never thought that 10 years later, I would be moving back to the United States. Thank you, Brittany. And I would be doing the job I'm doing. So I'm very fortunate to be able to do what I do. So I'm the director of community outreach here in Northern New Jersey. We are a nonprofit organization with over 50 years of service. We've had this cancer grant for the past 25 years. We cover both Hudson and Union counties, and it's a cancer grant for uninsured patients, regardless of documentation status. So what I do is anything and everything that I can to bring the program within our community. I remember I was given the task of opening up Union County in the midst of the pandemic, and I was never on lockdown. I was doing food distribution. I was at food pantries. I was going to laundromats. I was out and about in any possible way that I could to find all of our needed community vulnerable residents that did have no access to healthcare, that most probably had not been even screened in their country before they came to the United States. And we are doing such an incredible job at Hoboken Family Planning. We're currently providing almost 11,000 cancer site screenings a year. What makes us different from all the other grantees is we bring our services on site. For example, yesterday I had a cancer screening event for the Haitian Creole population at a church in Elizabeth. Next week, I'll be doing a cancer screening event at a library in North Bergen. So we actually bring our staff on site and we provide our 4 cancer screenings on site. From the beginning of this new grant year, which is the 1st of July till today, we've already detected 3 breast cancers. And last year we detected in all 25 cancers. And the importance of having this alliance and this partnership is we need a strong hospital-based system partner. So when we detect these cancers, we can get our patient into the system as soon as possible. And fortunately, this has been able to work very, very well. So what I like to do is go out on the street and walk and look around, see, feel, sniff the need, find those local community partnerships, whether they be through the local government, whether they be other nonprofits, whether they be churches, whether they be libraries, anybody and everybody I feel, schools, we work a lot with school systems, health fairs. We put ourselves out there. I like to say we like to cast the net and find those vulnerable populations to be able to take care of them and get them the care that they need. So that's more or less what I do.
Thank you, Nancy. Brittany?
Hi, everyone. My name is Brittany Church. As they mentioned, I am on the CAB of Case Comprehensive Cancer Center. So I am a patient advocate there. So patient advocacy is very, very important to me, because as we mentioned before, I am a breast cancer thriver. And I think it's very important for diverse populations to sit at the table while we're making changes, we're making goals. I think it's very important to have a seat at the table. And so right now, what I do work with, again, I work with CASE, and I started from the beginning of the grant. And it's actually been amazing. The work that we're doing now through navigation, I kind of help shape some of those things. As a breast cancer thriver who was diagnosed very young at 32 years old, with no history in my family. I remember when I first got to the board, and the initial age was going to be 40. And I remember raising my hand and I said, wait, I think that the younger ladies, gentlemen are being dismissed, especially if you don't have any history. And I was one of those people. And so I think it's very important if anybody is showing signs of a possible malignancy, they should be able to go through the program, no matter the age. And so I was successful in helping that age get dropped. And so now Case is looking for everyone who has some sort of symptoms. And so, again, that's important for me as far as advocacy, because if I was not at the table with my certain characteristics, that may not have been the case. It may have still been at age 40, and I was diagnosed 8 years prior to when I should have been getting my first mammogram. So again, the work that we do at Case is again very important. But I think what they do there, which is really good, is that, when we kind of first started, we really established like a really strong foundation. It was kind of clear and purposeful. Our board is very diverse. We have some caregivers. But again, we're also empowered to do the work. Not only are we just kind of advising about what we think, but we're also kind of walking through what some of the patients will actually see, and we're actually navigating that to get a feel on how the patients will actually feel. So I think that that's amazing, because I'm able to advise through my lived experiences what I did not have in the hospital chains. And so what I also love is that they really take our insight, and they kind of, try to incorporate it as much as they can. They ask a lot of questions, and I really feel heard. So I'm all about leveraging. I'm all about advocacy in any way possible, really, but really looking for our young African American or women of color, um, advocating for them, because sometimes they don't have a voice or we don't have a voice. So I think it's very important that we continue to sit at the table so we can have a voice. And working with the Case Comprehensive Center and the Merck grant has been really helpful for that. I've learned a lot of new things, and I'm continuing on my advocacy journey, while also participating in other advocacy journeys with some national organizations. And so I'm really, really excited about this. This makes me feel really good. I didn't know where I would have a seat at the table after being diagnosed. I didn't even know if I wanted to have a seat at the table, but as I was continuously getting pulled and tugged on, I knew this is exactly where I need to be. So I'm really thankful for being here. And again, I'm all things patient advocacy. So thank you.
Thank you, Brittany. Hyro?
Yes, good afternoon, everybody. And I guess I haven't really I rarely speak about being a cancer survivor. My wife passed away 16 years ago from colon cancer. And and I think one of the things that is important with regard to having hospitals that are extremely well known, who are, at the top of their best when it comes to treatment and care, being hospitals that often they're very detached from the community that needs them, right? And community members who seen uh, by different factors and different things that they are not able to access the care at that level. And so it is to me very important to realize that, had I been more educated about what cancer was, would my wife be here? Had my wife, Brittany, when you mentioned about the fact that, we tend to dismiss certain populations because of their age, and we say they're not at risk. My wife was less than 40 when she passed away of cancer. Has she been asked to do some testing? It might be another story, right? So to me, it's been very clear that institutions, especially those institutions that are seen as the very, very best in their field, are often also the institutions that seem to be very, very exclusive for those families and persons who could benefit the most. Persons of color, right? Persons who look like me. That we tend to think that a top-rate hospital, it's not for our community. And so making sure that we are partnering with the right institutions, that we're bringing a world-renowned hospital to our neighborhood, to our church, to our schools, to different parts of our communities and neighborhoods, so that people there can have an opportunity to learn, to hear what are the signs, what are the red flags that they should be looking to, right? And that is not just a women's topic when it comes to many of the issues that we are talking about, but that men and women and children should all be exposed to this conversation. There's a certain fear of we can't speak about it, right? Thank you.
Thank you, guys. I knew that this was going to be dynamic, and it has already started off exactly how we had envisioned. So thank you for those introductions. And let's just jump right into the questions. Again, for our panelists and for our attendees, we submitted a link for you guys to submit us some questions for our phenomenal panelists. And I'm just going to kind of go through some of these questions that were previously submitted. We're going to start with just a general question for all of our panelists. And then we'll kind of branch out and start asking some very specific questions towards each target area. So first, in your opinion, where should community engagement start? And what we mean by that question is we often say in academia, we call ourselves the ivory tower, right? So should it start at the ivory tower with this research idea, and then we take it to the community based off of what the data is telling us? Or should it start in the community and the community inform the researchers about what should be done and how research should be implemented? And that's for everybody. Just jump on in there.
All right. Okay. Brittany or Nancy, you want to go first?
Go ahead, Brittany.
Oh, okay. So what I was going to just say is that I do believe that community engagement should start in the community themselves. I believe that we do need to meet people where they are, in their neighborhoods and churches. And I see you all are already kind of doing that. So that is amazing in the community centers. And I say that because healthcare institutions, sometimes you can seem like you're isolated or just kind of disconnected from the daily realities of people that we really serve. So I do think that initiating engagement within the community really helps build trust, identify real needs, and then develop really cultural relevant solutions. So I am with the community group.
Okay, so I'll jump in there. So I'm referred to in many circles as a one-person army, and that's really what I am. So yes, I am out there and about all the time. I definitely, and needs are so shifting because with what's going on here in the country and immigration wise, there's so many different waves of different diversity and ethnicities. Even just here in New Jersey, for example, we have people from Cuba, we have people coming from Ukraine, we have people coming from Afghanistan, Central America, people coming from all different places and at different times. And if you don't know what your community needs, how can you serve them? And you can't serve them from an office. You've got to go out there and you have to meet with them. And Brittany, the trust is so important. From me being a cancer survivor, sharing our experiences right with them. They trust us, they open up to us, they tell us what problems they're having. And they really rely on us, you know, to calm them down once they're diagnosed with cancer, to get them into the right place where they can be seen and treated ASAP. So I am the one person army.
No, I agree completely with what Brittany and Nancy are saying, that it is at that community level. Right? We know exactly how to engage our folks. We know what to say or not to say and how to say it. And often, because we don't have the MD initial, we are able to use words that make more sense, that are easier to digest. I do appreciate academia. I think it's sensational. But our communities have also had bad experiences.
Mhm.
The academics landing in our neighborhoods to do research, taking the knowledge, leaving and not coming back and sharing some of that information of what's being learned. And our community knows that that happened very often in the past and that it may continue to happen. So they look to who among us can they trust and engage in a conversation that is not full of jargon, that it is more direct, that is easily understood. Persons who have survived and experienced some of these have a leg up, right? No one's going to tell Nancy or Brittany, what it is to have cancer and what it is to go through that. They're able to speak to it directly from experience. And I think that is powerful, much more powerful than presenting a chart with regard to, the research that has been found, no matter how up to date that research might be. It's a system of care that relies on people. You need to be with the people.
So I'm going to build on that. As a community partner, since we all said, well, this should start in the community. It should start in the community. How do you suggest that we actively engage all parties of the community so that all voices are heard? I know sometimes in my work, the squeaky wheel gets the oil, right? So how are we making sure that all of the voices, all of the stakeholders are being the voices are being heard, from the small to the large? And how are you identifying what's a key stakeholder and making sure that these stakeholders are vested in the community as a whole and not just in their purpose?
I think, if I may, with regard to, it's always going to, you're never going to have the right amount of people around the table, or you're never going to have all the people that should be there. And it's going to be language, it's going to be education, it's going to be time, right? So it's important to be able to come in and know that no matter how strong a round table you might want to have, you're still going to have holes in the information that you're supposed to be picking up and that you need in order for the system to become better. But I do think the important piece there is knowing that you do have holes, and knowing that in order to begin to fill some of these holes, is inviting the non-traditional community leaders, right? Nancy, Brittany, I don't know if you mentioned you speak Spanish or not, but Nancy, certainly you would know that las chismosas, right? The las comadres, right? These people who are the ones who are quick to share information. They know who's who in the neighborhood that doesn't have a PhD, that doesn't have an MD, that doesn't have an MA, but they know how to get the message across. And those are the people that we need to work to make sure we find a seat for them at the table, because they are bringing the real stuff to the table and able to enforce us to become better at the service that we are saying we need to provide.
I agree.
This is very true. So, for example, what I've found through my experience, because I will knock on every single door that I find. And if I always say, if I can't go in the front door, I'll go in the side door. And if I can't go in the side door, I'll go in the back door. Right. But what I found from my experience, so I've been doing this now for over 10 years, is that you have to find organizations that have a common cause and a common goal, that they want to be as interested as you are in getting the word out. I have so many cheerleaders, you can't even imagine. I have social influencers on Facebook, like Jairo said, las chismosas, so that's a gossiper in English. So I have my gossipers that, for example, if I'm going to do a cancer screening event at a church, I'll send them a flyer the week before, and on Facebook and social media, the thing starts to explode. We'll do a cancer screening event. One person that's there starts calling another and another and another. And I also have a team, like I said, of cheerleaders that don't even like work with us, but they work for us, but they work with us. So for example, if I'm doing an event and the New Jersey Department of Health is there and they're doing vaccines, they'll say to me, Nancy, give me some flyers. Give me some flyers. We know of people that are in need, or I'm going to be at the library on such and such a day. They're doing library ID cards, because one of the most important things for people that don't have immigration is they don't have an identity card. So it's super important for them to have their identity card. So we look for certain places like that where we can add to what they're doing. And you have to be really creative. I find being creative really works.
It's kind of just to add on with what you all have already stated, is that I think another really, really important piece, you kind of touched on it a little bit, Nancy and Jairo, is that just empowering the actual community members, right? I say this for an example. My husband, he works at a barber shop, and Case also has a different program that works directly with barbershops in the community, and they are giving out prostate screenings, but they're working with the barbershops in the African American communities to work closely with that population. But I think that it's amazing, because that's what they sought out. We're going to go to the barbershops because we know that men go to the barbershops on a weekly basis. We know that you've already created a relationship with your barber. Let's empower the barbers to encourage the men to go get their screenings. And in fact, that has educated even my husband on screenings. And then we have already kind of gone through, my father-in-law has stage 4 prostate cancer, and that has also empowered my husband to continue his follow-ups. And then I was able to use my resources through the Case Comprehensive Center about the navigator that I worked with in another county that I met at the Alliance, and I was able to connect with them to make sure that my father-in-law understood what was going on. So I think, one, making sure we're empowering the community members as well, but also really, really creating those safe spaces for people to feel safe to even kind of talk, or even engage with community partners. Nancy, I really do like that cheerleader, because we do have a lot of communities out here in Cleveland who we can send a flyer out and say, hey, we're doing this. Can you set this on your social media? And people are already super engaged. They're very trusting of that community partnership. And so that is how you can bring, especially if you're new in the community, how you can bring people there that may, benefit from cancer screenings and things like that. So I really do like that cheerleader. And I'm kind of one of those cheerleaders outside of my breast cancer advocacy, because I do work in the community as my daytime job. So I definitely understand the engagement part. But I think that that's very important. And I do think that empowering our community members, because they are they can be really effective advocates, even though they may not have actually went through cancer or some of that sort, but maybe they know somebody. But again, they have that trust and relationship, what we need in our communities.
Marcy, if I may add, because I do think that, as I mentioned with regard to the non-traditional partners, Memorial Sloan Kettering, for example, has partnered with the Mexican government, has partnered with Latin American consulates to make sure that they're reaching communities at places where they feel most safe. And that is extremely important, because the expectation for many years was that if you need information, you have to come to us. If you need service, you need to come to us. a world of difference now. Memorial Sloan Kettering coming to our church and having a mobile unit where they're doing testing, where they're doing education, engaging with the consulates, and having the consulates be the persons who are telling their nationals, here's a partner that you can trust and listen to and ask questions of. And I think those kind of relationships are extremely important when it comes to engagement.
So what I'm hearing is three real take-home pieces. One is the advocacy piece, right? We have to be able to ensure that our communities are able to advocate for themselves. The second piece would be to meet them where they are, meet the community where they are, go to the community to make sure that the community is engaged and that they feel that they have a seat at the table. And then the third piece is this authentic engagement, right? Keeping it real is how I like to call it, but the authentic engagement. So three take-home pieces that have already kind of emerged thus far. So crystal ball, right? In a perfect world, what would effective community engagement look like for you? So if everything could align and I had $9 million to give you to ensure that community engagement was just flawless, right? What would effective community engagement look like? What would that look like? Look at Nancy. Nancy's like, if you're going to give me 9 million, I can give you a whole list.
Okay, so how much money do we have? Can I have a mammography van? Can I have a van for pap tables? Can we do prostate and colorectal screenings and do additional services at the same time? I mean, that would be the perfect world, right? We try and achieve these things. Obviously, it's not perfection, but I think we have a pretty good system in place of where we will see the patient. We will provide them with the screenings that they need. We will give them a script on site to get their mammo. They will not leave without a date and a time. We will follow up with them. We will send them to our partner, RWJ. We're very fortunate that we have actually at least 3 hospitals. I mean, who has that? You know, we're very spoiled. We are very spoiled. If we can't get them in one, we'll get them. They'll get them in another, and that can happen. I had one patient that was diagnosed with breast cancer on a Thursday. The following Tuesday, she had her surgical consult. So that's pretty darn good. But if I had a lot of money, then I could do a lot more. That's all I can say.
Go ahead, Brittany.
Oh, okay. I think all of that from Nancy. I do think that for me, the crystal ball would be a really good streamlined process. In Cleveland, we do have 3 main hospitals that people seek out, and the appointments, like you said, Nancy, you want someone to lead there with the appointment. I wish that it was just a really streamlined process where you did not have to, oh, I have to call somebody else to get that, or I have to check there. I wish it was just, here's the appointment, here's your surgical oncologist, you can go talk to the radiation oncologist, you can go talk to, if you were young like me, you can go talk to fertility, all of these things in that one appointment, because I think that people get so overwhelmed, and I think that it's just so many, and that this may just be to Northeast Ohio, Cleveland. But it's so many pieces and parts, the moving parts, where people just kind of get fatigued and overwhelmed. And then that's how I do believe that people fall through the cracks. So, for me, a crystal ball is a streamline. And if all 3 hospitals could work together in a way where we have like a hub of one where you do all of your appointments and then you go to whatever hospital chain you want, because I think, again, people won't get as fatigued. But I do think that the navigation piece of it will help with that. But that is one of my biggest things. Just making sure people can have, making sure we're effectively communicating with the community. The other thing is I also would love to see is that really community members really helping with all aspects of like our healthcare. So, helping with implementation of program design. And specifically, if we're dealing with cancer, get some faces that have dealt with it. Again, because that will build the trust that you need from the community.
And I would add that, certainly I wouldn't be saying let's rebuild something that is already built with regard to some of the services. There are really good services being provided by very good partners. What I do think is needed is an investment on the actual network and communication itself. I'm asking my staff to call, we're making phone calls day in, day out, all day, sending WhatsApp messages continually. And this is on top of what they already have to do, right? We are constantly getting volunteers to come in and help with the phone calls to make sure that everybody's getting a phone call. Right? It is hard work and they should be paid for that work, right? If we're honest and truthful about the importance of prevention, we need to invest in preventive work. And preventive work is education, is providing people the information they need very, very early on. It's providing it in the language they need. We work with many persons who are of irregular immigration status. So they don't have health insurance that will cover many of the expenses that they need. So preventive care is even more important to that population. When Nancy mentioned about collaborating with institutions that work with people who lack ID, do you know that New York City has one of the largest populations of people who are double undocumented? They don't have a document that proves that they have a right to be in the United States, nor a document that proves that they are from the country they say they are from. That makes them double vulnerable because many institutions require for you to have an ID. So we need to invest in creating a system, so identifying partners who are willing to be more creative, who are willing to be more accepting of those special situations. We should be able to have systems and partners that are willing to serve a person who needs the help there with or without insurance, with or without an ID. And I think that's what we need to invest also. Look at what's working, look at what's not working, and those special situations that many other persons are having. Because New York City, again, it's one of the cities that has one of the largest segments of people without a green card, without citizenship, and without a document that proves they are from where they say they are. And that also prevents them from getting identification that would otherwise facilitate access to other services. So I would invest the $9 million you would give us in strengthening that kind of system.
Dr. Wynn, I need 9 million a piece. Okay. So let's transition really quickly into, well, before I do that, I want to piggyback on something that Nancy said earlier, which was your one-person army, right? And that just kind of stuck with me a little bit and resonated. How do you feel that we could assist our community partners in not feeling like they had to be this one-person army? Like, what can we do from this end to kind of help you to facilitate and navigate and to assist you so that you don't feel like you're out there alone pushing this?
So I think the most beneficial thing that has happened to me as far as being a one-person army is now having the RWJ realize the importance, like Brittany said previously, because that's your field is the navigation. So beforehand, I was a navigator.
Mhm.
So I was a navigator. I was the one doing the Uber rides, right? Pulling off the highway, directing patients, because one of the things that's been a real game changer in having our patients come and keep their appointments is having this transportation. So now having the hospital system, RWJ, they have funds for transportation. So it takes the Uber off of my back a little bit, and having the navigators. So now I don't have to navigate the patients, because what happens was, since I was providing all the Uber rides, I was the one who had the contact with the patient. So
Mm.
when the patient was diagnosed with cancer, they would call me personally. So how am I going to hang up the phone on them? You know what I mean? They're so afraid and they're so scared and they don't know what to do. So, you really feel like you have to walk them through and everything. But now, since we have these navigators, I can direct the patients to the navigators, and the navigator will, in a prompt fashion, get back to me. So it's taken a lot of work off of my back. And I hope it continues.
That's a clear example of how the alliance is starting to make a difference, right? You have this navigation model that's accessible to you now for you to be able to say, hey, listen, I'm gonna refer you over to the transportation services here. And so this is concrete evidence that navigation is effective and that it works coming straight from the community. So
Yeah,
I
and not only that, Marcy, but they're also helping out, because I get all sorts of phone calls. I get calls about housing. I mean, you have dentists, you have no idea of legal rights. I'm getting thrown out of my apartment, etc. I send them over to the navigators, because these navigators also help with food disparities and other issues. So I send them there.
Wonderful. Wonderful. Okay, I'm going to transition now to some of the individual questions. And I'm going to start with Brittany. So, Brittany, right amount, right time, right place. What's the sweet spot for engagement from large health systems to community partners without feeling burdened? And what's too much? What's too much? How frequently should we meet? How much is enough? What does that engagement look like?
Um, so for me, this work means a lot to me, personally. So, I'm okay with every month, but I say that to say as if I don't have enough going on. So if it was every month, I probably would be overwhelmed. But I think that Case does an amazing job with keeping us engaged. So right now we meet quarterly. And then if we need some additional, while we're all pretty flexible, because we met quarterly, but then we needed to meet a little bit sooner than our next quarter, because they wanted us to kind of look at the what they use for navigation. So they wanted us to go through and actually walk through as if we were patients. So we met a little sooner than that. So I think that's great, because that is allowing flexibility. So I do think that the quarterly is just enough. We get in there, we kind of have already kind of created a family. We're really engaged with each other. We kind of keep up with each other. I had one of the other members, he contacted me from someone from the neighborhood that got diagnosed really young. So we've kind of created a really good partnership. So I do think that quarterly meetings is fine, but I do think as um that we need to make sure that we're, pretty flexible in terms of getting with the organization need, because that's, what we're here for, to actually help navigate. So we want to be partners and from the community. So the quarterly works well. So I think that's just enough. I think if we were meeting once a month, that may overwhelm people. For me, I think I would love it, just added on to the additional things I already have going on. But we do have a very diverse cab. So we want to be mindful that we are making sure it's good for everybody. So I think usually every quarter we usually see everybody face. So I think that that's working for Case Comprehensive. Um, I think no less than that, though, to make it to, still be kind of personable and really understanding what's going on. I think that quarterly works no less than that. I can't see us doing twice a year or anything like that. I think that's less what we would like to see in order to really kind of make an impact um, within the healthcare system.
Okay. Thank you, Brittany. Jairo, as a healthcare organizations engage with community partners, how can we guarantee those partnerships are equitable?
That's a tough one, in part because it will be very difficult for partners to community-based partners to be on the same level field as would be a hospital like Memorial Sloan Kettering, a hospital like New York Presbyterian, or any other hospital. There's the level of expertise that can also be when meeting with hospitals and universities, right? Who have yet another level of expertise, and agencies like ours, right? The Mexican Coalition being a small organization, and many others the same as mine. I think it does require the hospitals and other stakeholders that have a much more heavier level of expertise and wealth, that they can actually afford to have someone whose job is specifically to engage the community. It's very different for organizations where it is community engagement and community support is one of many other things that have to be done. And I think figuring out how do big partners support smaller partners to make accommodations so that we don't have to go to the partner, but perhaps the partner comes to us. That if we're inviting other community members, that the welcoming place is welcome. Right? And often that means, who's bringing the coffee and the donuts and the refreshments that are extremely important to creating an atmosphere where we're all welcome to share. And then making sure that we're creating also places for persons who do not speak English. Again, at the Mexican Coalition, we work with many indigenous persons from Latin America. So we have persons who, here in the Bronx, for example, we have the largest concentration of persons from Honduras who speak Garifuna. East Harlem is a 10-minute ride from where we're at. It has one of the strongest concentrations of people who speak Mixteco and Nahuatl. Right? If we go into Brooklyn, we have one of the largest concentrations of people who speak Quechua and Mam. So we need to be cognizant that if we're going to place a chair and invite someone to come and sit and be around the table to engage, that they are also able to communicate. And so investing in leveling the fields to make sure that in an effort to also fill the chairs, we're not creating a system that is imbalanced, right? That we're not making the necessary accommodations so that those who don't have as much, those who are usually at a lower place because of their barriers, the language barriers being one, that we make sure we recognize it and make sure that we are not saying that's a challenge, but actually a strength. And that is going to help the network become even stronger because they'll be able to communicate with that many more people. So it's identifying those barriers and investing in making sure that we're leveling the field with expertise and with funding.
Awesome. Nancy, one question for you quickly. How have you been effective in breaking down silos? I've watched Nancy in action, so I've kind of seen this play out, and you just have a knack for it, right? How have you been so effective in breaking down your silos?
Well, I truly believe in that likability gene, Marcy. Connecting with people, having them connect with you, having them trust you, having them want to talk with you. I think that's why I'm such a person-to-person people. That's why I believe so much in doing my community outreach out on the street, because engaging the community, listening. As I say, what's the saying that there's a reason why you have two ears and one mouth, right? So listening to the people, just listen, and they see that you're genuine, they see that you're authentic, they see that you're a caring person. I think that those are all intangible elements that in my line of work seem to be transmitted over to other people.
Fabulous. Okay, one last question that I just have to ask before we transition to turning it back over to Dr. Nguyen, is what technical assistance? So we talked a little bit about advocacy in the beginning, and I want to kind of circle back to that. So what other type of technical assistance do you feel like is needed from the community level to facilitate bi-directional engagement? And that can kind of go out to anyone. So as we talk about community needs, what are some of those technical assistance needs that you feel like is necessary to facilitate this bi-directional engagement that we've been talking about for the last 54 minutes?
I would say, piggybacking on what Jairo said, obviously communication, if we don't speak the same language, how can we communicate? So having all of these translation services, which are ongoing with the hospital system that we're working with, I think that's really going over a big obstacle for us.
I think just having accessibility for I know you spoke about languages, but just, what if we have somebody who's hearing impaired? What if we have somebody that's blind? Just whatever you're utilizing, making sure that it's accessible. And that was one of the things that I mentioned at Case, making sure, some of our diverse cap, they wanted just paper. And then I said, we need to be flexible. We need to offer paper, but we need to also be utilizing iPads, because myself, at a younger age, I don't like shuffling through paper. I'm also a tech person, so that's different for me. And I start thinking about, is it going to be secure? Who's going to be reading this? If you're shuffling through papers, I don't know if I would trust that. So I think we just need to be flexible and how accessible we are for whatever we are trying to put out in the community. Just like you said, Nancy, making sure, that barrier is crossed, but also, if I am deaf, do you all have, are you capable of assisting me because I am hard of hearing, or if I can't see, can you assist me in that way?
Yeah, again, I would say that I think everybody needs to be ready to invest in what needs to be invested. Whether it is the language piece and having money to pay for translators, interpreters, whether it is money to invest in technology, whether it is money to invest in some of the requirements that health institutions need. I did not know I needed to have insurance to pay for cybersecurity on my end, because we're a CBO that does not do healthcare. But partnering with MSK and other hospitals, all of a sudden they're saying, no, you need to have you need to have this kind of insurance. The insurance costs money. So sometimes added requirements automatically close the door on potential partners. So being open to hearing what are some of those very real barriers that keep partners from coming around the table and sharing is important. And I think that kind of education, of it going education to us so that we're better versed with regard to what cancer is, and education from going from us to our partners who need to understand those very real challenges that we have. Thank you.
So before I turn it back over to Dr. Nguyen, I just wanted to highlight just a couple of things that kept coming up today. Number one, meet the community where they are. Number two, trust. We have to build trust with our community. We need to teach advocacy and teach our community how to be able to advocate for their needs. Authentic communication. Streamline care to ensure that it's better coordinated. It takes an army, but having a coalition that can support your grassroots effort sure does help. Let's get creative. Innovation is needed to ensure that we're meeting people where they are, but we're also expanding the services that are currently in place to ensure that we are fulfilling the need that is in the community. And finally, don't just fill the chair. Be purposeful in your engagement and ensure inclusive engagement in all that you do. So I want to thank our panelists for their time. And with that, I'm going to turn it back over to Dr. Nguyen.
First of all, I just have to thank the panelists today. I mean, thank you so much, and not only for the wisdom that you brought, but actually proving for once and for all that we are certainly better together. So thank you for that. Got to give a shout out to Dr. Wright. I know she doesn't want to, and her team for actually organizing this and putting it together. I think that hopefully this will not be a one and done, but we will learn from this and continue these, what I call critical conversations, so that we can move forward. Having said that, I want to thank all the panelists again. I want to thank the grantees. I want to thank the community partner or whomever joined this webinar. Thank you from the bottom of my heart, because I think that the work, there is new hope, and I don't use that word lightly. And there is a new, I think, I'm going to say new energy that hopefully within the next coming years, not only will we understand the power of community in the context of navigation and removing blocks, but many others will in the country. And that starts with us. So again, thank you so much, and looking forward to the work that we'll do together. Back to you, Marcy.
So let's make sure that we complete our post event survey that is rolling out. I believe it should have popped up on your screen while Dr. Nguyen was talking. If you have any questions or concerns, please make sure that you reach out to me. And again, we thank you for your time today. The recording will be made available to you once we have a little bit of time to clean it up a little bit. And we will post the link on the Alliance's website. So again, thank you guys for all that you do. Thank you, our amazing panelists, and thank you, participants, for taking the time to join us today.